I'm Dr. Nirmish Shah, and I'm Director of the Sickle Cell Transition Program at Duke University Hospital. I take care of both kids and adults with sickle cell disease. So we've come a long way in regards to the therapies that we have with sickle cell disease. It's just exciting that we finally have a lot of research going into sickle cell disease. We've actually come a long way from just having one therapy for sickle cell, which was hydroxyurea, but we now have 3 additional therapies. We have Endari, which is L-glutamine, we have Oxybryta, which is Voxelotor, and then we have ADAKVEO, which is Crizanlizumab. And so these 3 new medications are now added to our list of options for therapies. The first question comes up, well, which is the first thing that I need to consider? And it's hydroxyurea. We have so much data to show that hydroxyurea does so many good things. So it improves pain, it reduces the chances of you having complications. There's actually data to show that patients who are on hydroxyurea live longer. So there's a lot of benefit to hydroxyurea. But now with these other medications that we have added as our options, we can add to hydroxyurea. And so we'll start with the first one that came about a couple years ago, which is Endari, which is L-glutamine. So L-glutamine is an amino acid. It acts as an antioxidant. So there's a lot of oxidative stress when we're talking about sickle cell disease and all the stress that your blood cell has to go through when it sickles and then not sickles. And that causes this oxidative stress that this medication can help you with. And it's been shown to decrease pain, and it's something that we can talk to you about. The next medication that came about was Oxybryta or Voxelotor. And Oxybryta, very simply, is a medication that just prevents sickling. And when your cells don't sickle, they last longer. They actually survive for a longer period of time. And the last medication is ADAKVEO or Crizanlizumab. Very simply put, ADAKVEO is trying to stop the stickiness in your blood. So it's kind of like a lubricant. It allows the blood to flow a little bit easier. And with sickle cell, we want blood to go everywhere. We don't want there to be any issues with blood not getting to your organs. And so this would be a medication that has been shown to improve pain, and we can talk to you about how that medication might fit into your treatment as well. Another treatment option that is reserved for patients who have a matched sibling donor or has a severe complication is considering what's called a bone marrow transplant or a blood and marrow transplant, where essentially we're taking the marrow out of you that has sickle cell disease and we're replacing it with marrow that doesn't have sickle cell disease. It is an intensive therapy, but it is really at this point our only curative option for sickle cell. If you look at reports a couple decades ago, only 50% of patients with sickle cell disease who survived into adulthood. Now we know that we have great newborn screens that identify patients with sickle cell disease around the United States. And so we can provide advice and manage patients very closely. And with that, we now have over 95% of our patients now surviving into adulthood. And even though we still have room to go, we want to continue to improve our care for patients with sickle cell. We've made a lot of progress, and I'm optimistic that that'll continue.